Hey everybody, welcome. Just want to make sure you can see my screen okay. Hello. So this is a lecture about the clinical application of mindfulness-based interventions, one of which is acceptance and commitment therapy. So I'm going to be your guide today, but before we get started, let's take a moment to ground ourselves, to fully arrive to this present moment. You may start with noticing your feet and wiggling your toes, or even adjusting yourself in your seat, making sure that your sacrum and your tailbone all feel really comfortable. You may take a moment to roll your shoulders up and down. You may take a moment to swallow, close your eyes, or keep them wide open, whatever feels comfortable for you. So I have a picture of an individual watering a garden, and this is very much just how I'm conceptualizing today's lecture, of this idea that we're just here to kind of nourish some seeds that have already been planted during your time as a counselor in training in a mindfulness program at Naropa. So the idea is that when we create mindfulness in ourselves, we're better equipped to be a conduit of neutrality. And so we'll add in things like, of course, doing active listening, reframing, being able to name emotions. But in a lot of studies, what we see people are looking for when they come to psychology, counseling, or to see a social worker is they're kind of looking for three things. And those three things are a new perspective, someone to process with, someone to talk through ideas or a situation. And then the third thing is a tool. What tools can you give people? So hopefully you have a good sense of how to do processing work based on counseling relationships 1 and 2. And then this class is really designed to pull all of your information together and give you some concrete tools you can use for yourself, you can share with loved ones, and of course, take into a clinical setting. So let's jump in. We'll start off with defining what is mindfulness in the field of talk therapy or counseling. Who are some of these key founders of this movement of mindfulness? How we apply it clinically, and then really expanding your clinical toolbox with the primary 6 of acceptance and commitment therapy. And then we'll discuss a PARQ and how important it is to offer your clients the procedure, the options, the alternatives of what you're going to do, some of the risks involved, and see if they have questions. And then we'll talk about what's needed for a case study so you can get going and practice this modality. All right, so mindfulness, coming from Buddhism, coming from Eastern philosophy, is defined as clear knowing or a clear comprehension. And so some of the Buddhist definitions are related to body fullness or mind knowing. But we can also see that these abilities to calm the mind so that you have more somatic awareness is also found in Tibetan culture, in Chinese culture, absolutely in Hinduism, and found all throughout India in various Sanskrit texts. So we're looking at something that has been in existence for thousands of years, and we're simply looking at the emergence of how it's transferring to the West in a clinical setting. So what we see is that there's several overlaps in Buddhist ways of being, and that those definitions have been formulated by Kabat-Zinn and Bishop. And so these are 2 primary scholastic authors that are really pushing this in a clinical setting. Both clinical definitions mention the need to be present or the need to be present-centered. So you can see when we're naming mindfulness approaches in a therapeutic setting, presence is the key ingredient. And you can see that goes to the definition of mindfulness of a clear knowing in various segments of Buddhism. So, we'll talk a little bit more in depth about how this being present fits into the modality of acceptance and commitment therapy. So, as we look at mindfulness or presence in the context of the 20th century, we see that humanistic psychology absolutely has been pushing the notion of presence, as well as cognitive behavioral therapy within mindfulness movements. So we can see parallels in the development of behaviorism, and we know behaviorism involves people like Pavlov or Watson or B.F. Skinner. We're looking at, first we start off with more non-human studies. How can dogs salivate at the noise of a bell? Just hearing it, salivation happens. And the same is true of reinforcement with humans, where if you tell someone, hey, good job, we want to do that again. Or if you're a third grader and your teacher gives you a sticker for your attendance and you know you get a reward at the end of the term, you maybe want to attend more. So all of this fits into behaviorism, but what we're noticing is looking at the cognitions and how thought patterns also create behavioral patterns. Because if we have a thought, right, it often is operating from a core belief, and that core belief encourages us to certain directions, right? Like if we believe that eating healthy food makes us feel better, it gives us clear, thin skin, then we're probably going to want to eat healthy food versus if we love McDonald's and we have really strong associations with it. So we're seeing that mindfulness really has this intersect of presence and noticing cognitions. Some of the overlaps that we're seeing when we're talking about mindfulness based therapy is non judgmental observation of thoughts, feelings, emotion, being able to hold the observer's seat, practice validation, right? Like, hey, it's okay to feel anxious when you're taking your medical board or when you're taking your counselor exam. It's normal. We're also looking at the difference between intuition, building an inner knowing, and we know that if a client has had traumatic experiences in their life, such as early childhood violence or physical abuse, sexual abuse, emotional neglect, all of that ruptures a sense of intuition of how do I trust myself. So we're looking to rebuild that and also hold the dance between being and doing, mindfulness in general, also letting be and making meaning. So according to Federal et al. 2014, these are some of the aspects that we're seeing emerging in the last 30 years of what we call mindfulness-based counseling interventions, mindfulness-based psychology. With that being said, I really want to highlight that anytime we are doing present moment awareness or just tending to the client's feelings, that absolutely is using a component of mindfulness. So there's several key founders, but probably the hallmark founder of mindfulness movements is going to be John Kabat-Zinn. And I have a little quote from him that I've included from the book, Some Reflections on the Origin of Mindfulness-Based Stress Reduction, Skillful Means and Troubles with Maps. So what he says here is, my hope is that people are attracted to this field and will come to appreciate the profound transformative potentials of the Dharma in its most universal and skillful articulations through their own meditation training and practice. So he's saying that, hey, as a counselor, we may not in a 50-minute session or a 90-minute session teach someone how to meditate. We may just be guiding them as part of our action step to take a meditation class, to try mindful movements such as yoga, or mindful movements such as journaling or self-study. So as we're working, we're guiding clients to certain mindfulness techniques. He also says mindfulness can only be understood from the inside out. So I think that's a really important perspective, and that's actually why I chose this particular quote. It can become so easy to intellectualize some of our models, but really, when it clicks in, is when you yourself have a really solid mindfulness practice that brings you to neutrality so that you can observe your own thoughts, feelings, and create space between reacting so that you can respond to a situation. So, really, we best understand this modality not through a lecture, not through intellectualizing, but really inward, and then that pours out. So, it's not one more cognitive behavioral technique that can be deployed in a behavioral change program, but this is a way of being. And your way of being when you practice has profound implications on the natures of our own body, our own mind. And so this quote goes on to say that without living foundation, none of what really matters is available to us in ways that are maximally healing, transformative, compassionate, and wise. Of course, ultimately, there is no inside and no outside, only one seamless whole, awake and aware. Yay, give it up for some snaps. What a beautiful perspective, right? There is no inside or outside, there's just one seamless whole. So, this is one of our key founders. He worked at the University of Massachusetts and started a mindfulness skill lab that has been in hold for about 30 years. And in this mindfulness skill stress reduction lab, basically they did things like vipassana, yoga, and measured how well it brought people's stress hormones down, how well it brought their sympathetic nervous system down from a hyper arousal state, which is sympathetic, you're aroused, and then the parachute, like you're coming down. So, through their research, they were able to show profound effects of using techniques that bring us back to the present moment, techniques that help us get in tune with our body, which is often breath. So, if you recall from our first day of lectures, I referenced a few different types of mindfulness. I want to get out of this habit of thinking that mindfulness is simply sitting down and in your head noticing inhale or exhale or clearing the mind. That's one aspect of mindfulness. But when we're looking at different meditation types, perhaps we introduce sound to the client and say, hey, there's different frequencies of your brain that respond to sound. So maybe you do sound, or maybe you're using a minute or two in a session of a visualization. If you could visualize that energy between you and your parent, would that energy be free flowing? Or would it be a little choppy? Or would it be stagnant? So sometimes visualization can give us really nice data points. It might also be movement, like playing with silly putty and seeing what that silly putty feels like for a kiddo and asking them to report how it feels. Does it feel scary? Does it feel cold? Does it feel goopy or icky? So just allowing the person and reminding them to tune into any physical sensation. When we're looking at movement meditation, that might also be crochet. Tons of people that come to sessions who like to crochet or use their hands or color. So that's the mindful movement piece of it. We also can focus on repetition. When we're giving our clients repetition, it might be affirmations. And that's a really nice way to focus the mind and give it a task. Like, I'm here, I'm present. So if your client is, let's say, has at home 5 kids, 2 of which are twins that are babies, and they're screaming, right? Teaching parent to say, ah, I feel screams, my heart rate is up. I'm here. So it's just can be small moments that we tap in using some of these umbrella of mindfulness tools. And then of course, breath, self-observation. These are all part of a constellation of what we name mindfulness techniques. So as we're looking at mindful aspects and we're putting this in a contemplative education in a contemporary society, and maybe asking your clients to just even notice, like, hey, when you're lifting weights, what does that feel like in your body? Or when you're running, can you really connect with the release. So, any aspects from sound, visualization, movement, repetition, breath, and self observation all fit under the umbrella of mindfulness interventions. So, as it applies clinically, we know mindfulness based cognitive therapy is combining this mindfulness piece, a clear mind, present moment, to look at how we can understand and manage thoughts and feelings through a self study. And then that allows us relief from feelings of distress. But here's the caveat to modern research. One, first, we just kind of have to laugh a little bit, but there are modalities that are thousands of years old. Like if we look at the I Ching, Tao Te Ching, it's 2,000 years old, written about going inward, slowing down, breathing, noticing one's cosmology. And in the West, we have to scientifically prove everything. So an insurance company can say, yes, that's an evidence-based modality, and then your client can get service, and you can have access to resources so you can get money, so you can live. So it's a bit of a strange system, a capital system that we're operating in. So when we're looking at the field of research, there was a meta-analysis published, or rather referenced, in Aniolo's article in 2019 that from 2007 to 2014, they were unable to fully establish all of the benefits of mindfulness. And here's why. There's not a clear definition of what mindfulness means. How wild is that? So here we are researching it for over 30 plus years, and we're still inconclusive on exactly what mindfulness is, other than anchoring into the present moment. Another article reviewed 33 definitions of mindfulness that were extracted from 308 peer-reviewed journals. And peer-reviewed journals simply means you're having your colleagues give you feedback and look at it, and it's really well done. So even in well done empirical articles, we see that the definitions are vastly different. And so we found that there's 33 different definitions of mindfulness, according to Google Scholar, Psych articles, and Socio Index. So if you ever start to feel like, what exactly is mindfulness in a Western context? You're not alone in that. There's currently, based on these three search engines, over 33 definitions. But for the purposes of this class and looking at how mindfulness operates in our field, we're going to use the definition of present awareness that John Kabat-Zinn developed in Massachusetts when he was working on these mindfulness stress reduction labs. So I have put this article a little bit more about the history of Buddhism, the definitions of mindfulness, and some of the issues with making it a more accessible point in our field in your course reading as optional reading. So if that interests you, please take a deeper dive. Yay! Okay, so now we get to look at the umbrella of the mindfulness intervention techniques. So thinking of this image here, you can see that there's one center point, but all of these different spokes. So for the purpose of this class, let's think of the center point as presence, and then all of the other techniques can be different spokes out. So as I already mentioned, we know that a Buddhist philosophy dates back 2,000, 2,500 years ago, and it was at the University of Massachusetts that this was developed. And what we're going to do now is deconstruct this big umbrella. In our class, we're going to talk about acceptance and commitment therapy, cognitive behavioral therapy, as well as dialectic, and then somatic interventions that are coming from the mindfulness stress reduction. So that's what we're going to do. At the end of the term, I'm going to do a 5NP block. It's my favorite thing to teach. Basically, what it is doing 5 points of acupuncture in your ear. One point is called Shenmen, which helps to regulate the heart. Another point is parasympathetic. And as we mentioned, the autonomic nervous system has two primary branches, one to get us into a fight, fight, freeze state when necessary, to protect ourselves, as well as a parasympathetic state so we can rest and digest. So, doing these points in the ear, parasympathetic, Shenmen for the heart, the kidney, the lungs, all of these points have been well researched to help with things like addiction, as well as create a somatic calm in the body. And this comes from our Buddhist philosophy and Taoism in Chinese medicine. Counselors in the state of Colorado are allowed to do auricular acupuncture, so ear seeds or puncture the ear with training. So this is a modality that you can offer. And I love being able when a client comes in and they're like, I think I might be having a panic attack right now, or I can't breathe. I can say, let's take a few breaths. And would you like a tool in your toolbox that will make an immediate effect before you walk out of the room? How special is that? So we'll get to that as our last block. But again, I just want to remind us that mindfulness can feel a little bit nebulous, as we saw with 33 definitions in 3 search engines. And it has various attributes. I just want to set those tone again: non-judgment, observation, validation, acceptance, intuition, being, bodily awareness, letting go, making meaning. The specific inclusion criteria for what is part of the cognitive behavioral of third wave is a bit loose. And so I just want to name that. So let's take a look. So these are different therapies that are found in third wave behaviorism. So we have acceptance and commitment therapy, which we're going over today. Of course, we have cognitive behavioral analysis. We also have mindfulness-based cognitive therapy. That will be the second modality we go over. And then in our third block, we're going to focus on the mindfulness-based stress reduction. And please remember that stress is also a nebulous term, right? It's not an emotional state. It's a term we borrow from physics. So with this, we're looking at really how to downregulate any type of hyperarousal in the body. And if you've done some of the reading in complex trauma this week, you'll see that there's a really great diagram towards the end of the first chapter that talks about the window of tolerance. I'm going to actually grab that. Let's see if I can find the book. But it talks about just allowing our clients to have a better sense of when they're in hypoarousal, aka depression, or hyperarousal. So with hyperarousal, we can feel anxious, restless, shaky, trembling, irritable, even rage. When we're hypoaroused, the lower limit to our window of tolerance, we can feel really lethargic, tired, heavy or depressed, even nauseous or dizzy. So we'll talk more about the window of tolerance and trauma-based therapies as we continue to work throughout the term. Okay, so I have a person jumping for joy because it's like, Dr. Denalo, this is all intellectual stuff. Give me the modality and how to use it. So let's jump in. This work comes from Dr. Stephen Hayes, and it's inspired by what we call relational frame theory. And relational frame theory really looks a lot at how humans create associations to an object. So we call RFT, or relational frame theory, this aspect of operant behavior that is learned through training and contextual cues that often relate unassociated or arbitrary stimuli to something. So here might be an example of RFT. A client comes in and they're like, I hate when people sing me happy birthday. And you're like, tell me more about that. And they're like, I have no idea why. And so perhaps when you tune into a mindfulness activity, or you take them to a theta or delta state of relaxation, a memory comes up related to a birthday. And so with a client, it might be maybe on their third birthday, a memory that had been suppressed emerges again around having to go to the bathroom, but everyone was going to sing to them. And then before they knew it, at 3 or 4, they wet their birthday dress and they were late to sing their own happy birthday. Did they remember this? No, because maybe they were pre-verbal to explain what happened, or perhaps it was so traumatic that the ego defense mechanisms from Freudian psychology came online, things like denial, repression, suppression. So maybe it got buried really deep down. So when we're looking at sometimes cognitive associations, there can be these interwebs, these networks of thought forms that are attached to other experiences. Now, here's a really important quote when we're looking at cognitive work. When neurons fire together, neurons wire together, meaning that if there's an association with humiliation and shame, every time someone hears the birthday song, it's because those neurons fire together. So our work is to tease them apart. So we know that other spirit theories that really can inspire acceptance and commitment is going to be first and second wave theories, of course, existentialism and humanism. But Hayes has this idea that thoughts and feelings are symptoms of a larger disconnect, and so they're not really there to be controlled. This is a picture of Stephen Hayes. If you want to learn more about this modality, I suggest the book over to the right side of my screen. So Hayes really forward the idea that there can be difficult thoughts and feelings, that it's normal. And the more we try to control them, the more suffering that leads us to. This is a little bit more of what I talked about of relational framework being rooted in human language association and cognitive stimuli that wires together. Some of the limitations, right, is that ACT doesn't have as much teeth or research because it's newer. 1986 was our first publication compared to Freudian psychology that's been around since the 20s. It's also really difficult to measure one's cognitive flexibility. We're going to define cognitive diffusion here in a moment, so that can be difficult. How do you know that you've fully unwired neurons together? It's tricky. And it's not suitable for all clients in all cultural contexts. Always a caveat. Clinical applications, whether you're online or in person. So we know that acceptance and commitment therapy is good for anxiety disorders and depression. So if you have someone coming in with panic attacks, this is the perfect modality to offer. If you have someone coming in who gets ruminating thoughts, often a response from trauma, also a really great tool to use. It's been tested on folks with personality disorders, substance use and eating, disordered behaviors, as well as workplace stress and chronic pain. Okay, here are the 6 core concepts. I definitely suggest taking a moment to draw this up for yourself. So maybe you take a moment and draw these 6 different aspects of how you're going to apply acceptance and commitment therapy in a session. So really with a client, I like to start as the self as context. So I might start with a question like, have you had any thoughts this week that feel important? Could be a question. Or are there any thoughts that have a charge to them for you this week? And the client might say something like, I'm unlovable when I fail at something. Okay, good to know. Or a kiddo might say, my friends were mean to me and they called me stupid. And so you're working with a thought and then seeing what networks, what dendrites are connected to that thought form. Are there feeling tones connected to it? Is there emotion connected to it? Is it the core belief that they're working with? And we help to deconstruct that. So we just start with the self as the context. Hey, how was your week? Are there any thoughts that are coming up? And if they're like, I have no idea, it's like, hey, let's take a minute and journal, self study, right? A type of mindfulness. Or let's take a minute one and draw. You could draw a picture of how your week was. Would it maybe be a happy face or sad face? Or maybe the client starts to write out, oh, actually, as I'm writing, I realize I feel really angry about this divorce. I feel upset that my partner is going to get all of the money and I'm just trying to make ends meet. I feel scared. So you might invite them to journal, to write, or maybe they're very verbal and they're just like, actually, I've noticed this week that I really feel unsafe around men when I'm walking on the street. Men are unsafe. And maybe you hear that in a session. So then we'd move to the next part of the model, which is let's be present with that thought. Let's be present with your sensation. So let's take the example of, and I'm very aware that this is untrue, a generalization and a global thought. Um, so let's take the scenario of men are unsafe. And let's say you're a male therapist. You might want to check in and say, I heard you make this comment. I just want to make sure that this interaction feels okay. Tell me more about the feeling or about the thought of not being safe. And they might say, well, I feel my heart patter when I talk about it, or I get knots in my stomach. And so then we just take a minute or two and say, let's be in the present moment. If you could give that sensation a color, a sound, maybe a scream or a weep, what sound would that have? So we get into the present sensation of feeling around the thought. And now here's the hard part. We work towards cognitive diffusion. Can we observe a thought without getting charged? We have to hold that as a clinician, and we can invite our client to also practice cognitive diffusion. So cognitive diffusion is the ability to see your thoughts as clouds. It's the ability to be an observer in your own mind. So we can even practice saying things like, I'm in a state of feeling rage instead of I'm rage. There's a little bit of space. Our Brené's Brown work is really nice at exemplifying cognitive diffusion, and she even started to teach it to her kids. So her kid was in kindergarten and was painting and making messes and had things everywhere. And the teacher said, wow, you're messy right now. And Brené Brown says that the kiddo looked up and says, I'm not messy. I'm in a messy state. And that is the perfect example of cognitive diffusion. It's not personalizing it. Rather, it's being an observer to something that you feel. Example, I often use a hand gesture while I'll tell the clients. It sounds like you personalized it when your kid said, hey, you're a bad dad. You never play with me. Can we put it out here and see how that thought feels? When you hear that thought, does it make you feel heavy? Can you attach to that thought? So cognitive diffusion, one of the ways we can work with it is by teaching people like, hey, can you take a breath? Or can you count to 5? And then react or respond. And often when we take that count of 5, we're better able to respond to a thought, to a feeling, to a knee-jerk reaction. So these are the first 3 parts of the model. Self as context. What's going on with you? How's your life? What do you want to work on in therapy? What are some common thoughts you're holding this week? Or feelings? Or vibes? Let's be present. Let's both take a minute to just sense our body in the seat. Part of being present might be offering, hey, let's color together. Or, hey, I know that you like to use your hands. Do you want to do silly putty? That might be great. And then cognitive diffusion. What thoughts are you having, right? Can we take a little distance back? Or maybe it's, I was driving in my car, the client says, and someone spit on my windshield and called me something horrific. Can we take that story and step back from it? Okay, first three. And now we move into the acceptance piece. So with acceptance, we're here saying, okay, there's some things I can change, there's some things I can't change. Let's really support what we can change, right? Let's say there's structural racism. I definitely want to change that. Is it going to happen today? Right now? Probably not. But what can I do in the moment to accept that, hey, that was really hurtful? And so the acceptance piece is really teasing apart, what can I do in this moment? What can I do next week? And then where can I let something sit because I truly don't have capacity to control that? Here's an example. Let's look at a couple who's divorcing. Perhaps it's, we have to accept you're going through a divorce. There isn't something we can change about that because your partner gave you paperwork. But within that, what things can you do and what can you experience within your locus of control? And so that's just a conversation. And then we move into the commitment piece. And this is where revisiting your stages of change through motivational interviewing, if they're not quick for you, definitely go back and review those because people can be in pre-contemplation. I might not be ready to stop drinking. They can be in contemplation. Yeah, you know what? I've been thinking about it. I kind of want to take a few weeks or a few months off of heavy drinking. And then the action set, it's like, okay, well, what is the action? And then falling off and getting back on. So you really got to be able to assess in this commitment piece using motivational interviewing, where is the client at on being willing to commit to some changes that are going to benefit them and some changes that aren't ones you're suggesting. No, they're suggestions that are coming from the client's worldview and the client's goal that you identified already as part of their context. And then values, right? So again, this goes back to, what is the client value? What are they here to work on? So this is an arc that you can move through in one session or in a few sessions. So you might take the first session to get to know the self. Hey, let's talk about your context. Let's talk about your goals for therapy. Let's be present with some things that are coming up. And then how can we practice responding versus reacting? So let's say there's a client who is really upset, and we know that they'll slap their kids sometimes when they're really angry. Can we encourage them to take a 5-second pause or to turn around and take a breath and grab a glass of water? And then go back to oh, I had a thought that I wanted to hit my kid. I don't have to attach to that thought, nor do I have to take action on that thought. I can give myself some space. And I'm not a bad person or a bad parent because I had the thought. I'm so overwhelmed that I want to hit my kid, right? So that doesn't mean that it's good or bad. It's simply, I had this thought. I didn't take that behavior. I gave myself more space. And then the acceptance piece of, hey, I can't change sometimes that I'm a really stressed out parent because I work 60 hours a week and I go to school and I have 4 kids and I have a family member in the hospital. That stuff you can't change. But what are the small moments that you can change with a client? And that gets into the commitment piece. Okay, what are you going to commit to? Maybe it's just a minute of deep breathing while you're taking a shower. Or maybe when you put your kids down to bed, you guys are all going to put on a guided meditation on your phone and listen to it as a family before you go to bed. And then going back to values. What values do you have? What are your goals for life? What are you getting out of this session? And then it takes us back to the arc itself as context. So if you want a more fuller definition of this, acceptance is acknowledging and embracing one's emotions without judgment. So, hey, like we gave the example of a divorce or abuse in a home. Hey, you had the feeling of being really angry and violent, but you didn't act on it. Or, hey, you acted on it. That happened. How can we accept it and then move on? Cognitive diffusion is detaching from unhelpful thoughts and even helpful thoughts and not seeing them as a capital T truth. As far as this cognitive diffusion piece, I have a really cool little handout for you with some tips on the 10 types of cognitive mishaps or distortions that can happen for people. So maybe you talk about the 10 cognitive distortions in a session with your client, or maybe you just talk about 5. And then we take present moment, being present. So if that's coloring, that's still presence. If that's writing, how your week was, that's presence. If it's a little body scan you want to offer your clients of, hey, when you say you feel stressed, is it in the shoulders? Is it in the head? Where do you feel it? Maybe do a little body scan, the presence. And then the self as context is observable changes and separating from emotions, values, so living by your own personal values, not the therapist. And then, of course, taking action. I love that there's an action component in this. It's a baby turtle. I was in Mexico earlier this summer and I got to see all of these beautiful tortugas, these big turtles, walk up to the sand, and they were huge. They're so ancient. Turtles can live forever. And they go at their own pace. They go really slow, and they hatched all these little babies that had to fight back to get to the water. But there's a point to the story. Why I'm talking about the turtle is not just because it's one of the most ancient tools of divination in China, where you look at the turtle shell, or I'm not talking about them because they're so cool. If you have a kidney failure or dysfunction, actually, they would give you turtle shell, which helps to revitalize kidneys if boiled and taken in a tea. So cool. But turtles go slow. And so when we look at American culture, we're very much like rats, right? Rats breathe really fast. They're like hamsters going in a wheel. And a rat, can breathe 100 times per minute. Very different than a turtle who can breathe 2 breaths a minute, right? They can go underwater for 5 minutes in just one full breath cycle, and they live to be hundreds of years, whereas rats only live 2 to 3 years. And they've done a lot of studies, even with humans. If you live in a big city where you speak fast, you walk fast, your life is rapid, your heart rate's fast, you don't have as long of life expectancy. Versus if you live in somewhere rural with resources and life is a little slower, you talk slower, you walk slower, your heart rate's slower, longer life expectancy. So I invite you, as you're sharing these modalities with your clients, to really take in that turtle medicine. Go slow. Take your time explaining what the modality is. Talk about the history of it. Talk about Stephen Hayes's work. Talk about John Kabat-Zinn being from MIT and developing this really cool lab with yoga and Vipassana, and how it had all of these profound implications on health, and how you have the tools to help with that modality. So PARQ, let me define what it is the procedure and any research with the modality you're offering. It's any alternatives. So if someone's like, yeah, I don't really want to do mindfulness, or breathing, it's a little stressful for me, I don't like that, then you give alternatives. And then you're also going to talk about, like, hey, what are some of the risks with this modality? And ask if the patient or client has any questions. So PARQ, I'm aware of this more from my medical training. It was required. If we didn't put in our chart notes that we PARQ'd somebody, points off. And also, this right here is a key component of trauma-informed care, meaning you're not catching the person off guard and you're letting them know what's coming so that they can make an informed decision if that feels good for their nervous system, their body, their heart, their mind, their psyche. So, informed consent is often noted through the PARQ acronym, and you can write it in the chart notes or you can say it verbally. So PARQ should be noted prior to the implementation of any modality. And if the patient requests or client more information, that you have that. And so you have a little cheat sheet on, yeah, like where did this come from? Or, yeah, actually, even though mindfulness is a diverse definition, it's been researched in various journals for the last 30 years with really strong outcomes for different populations. So for this modality, here's how we're going to work. You want to state to your client, I have some tools and I'd like to help you with them. One of the tools I'm trained in is acceptance and commitment therapy. It comes from behaviorism and mindfulness. Before we get started on that procedure, you probably need to do some assessments because you shared with me some symptoms that you want to work on. Maybe those symptoms are depression oriented, trouble getting out of bed, feeling really tired, heavy thoughts, or no thoughts. Or maybe they said, actually, I'm more hyper aroused. Like I have really fast heartbeat, my palms are sweating, my armpits sweat, I can't sleep. So you want to assess, well, what diagnosis, what intervention would be best for that client? And we don't know unless we assess. So you might start with an ACE, an Adverse Childhood Experiences Scale, to see if there is trauma. You might even start with Holmes's stress scale. These are all scales I'm going to put in the Dropbox for you to look at. But every time you're meeting with a new client, you absolutely want to have an assessment and then talk about, hey, based on this constellation of symptoms, here's a working diagnosis that I have. How does that feel for you? Do you have anything to add? Have you had this diagnosis in the past, or is this something brand new for us? And then we apply the intervention. So in this case, the intervention would be acceptance and commitment therapy. Know that if the person has trauma, you may say something like, you don't have to try acceptance and commitment therapy. You could also try things like EMDR, where we do a desensitization of the trauma memory. You could also try another modality like hypnosis, which is more about positive affirmations and less about revisiting the traumatic experience. So giving the person options. And then once you say, hey, we're trying this intervention, then you'll document how did it go? Was there progress? Was there not? Always discuss the PARQ. And then what we're going to do is in class, do a demo. We'll talk about a case study, applying acceptance and commitment. We're going to highlight the 6 core aspects and the client's progress in those different domains. We'll discuss the limitations and strengths of the intervention. Hey, Sage, I've got a little puppy here. And then, of course, you can always do mindfulness exercises like a breath awareness or a little body scan that we started with, as well as metaphors. We'll do leaves on the stream as one of the metaphors. Okay, this is my puppy. We got her at 10 pounds, and now she's 31 pounds, and I can pick her up. And she might grow to be 70 pounds. So you can say hi. And she probably needs some love and attention. So in conclusion, the Buddha has all of these beautiful perspectives on consciousness, right? And we know that there can be 9 different domains of consciousness from Buddhism. And really the first 5 are things like sound, breath. It's your 5 senses are the first layers of consciousness. So you are creating consciousness in other people by simply saying, hey, what do you smell? What do you feel in your hands? Like a warm puppy. I feel a heartbeat. What do you smell? Like a little bit of dirt. What does it feel like in your hands? It's weighted. So all of that is creating consciousness for your clients, your patients, your people. So Thich Nhat Hanh explains that our consciousness is composed of all of the seeds sown by our past actions, aka behaviors, and the actions of our family and society. Family, aka social conditioning, society. Gosh, we're talking about constructs like racism, sexism, genderism, xenophobia, capitalism, right? That's all part of our seeds of consciousness. However, every day, our thoughts, our words, and our actions can flow into the sea of consciousness, creating a new body, mind, and a new world. So, with that being said, I just want to remind you that this is a 6-part model that comes from mindfulness based interventions and behaviorism. And it is absolutely a way to hold and anchor transpersonal psychology by creating an awareness of us that's even bigger than the self, right? Because there are these seeds not just of our own personal thoughts and actions, but also the thoughts and actions of a collective world and society. So that will be our closing. Today we define mindfulness in counseling. We talked about some of the key founders, Stephen Hayes, John Kabat-Zinn, as well as clinical applications. Now in your toolbox, you have the 6, as well as hopefully PARQing, and we'll go over a case study, and then I really am excited for you to jump in and just try some of these modalities with your clients. Here are some citations for you. There's a lot more readings if you'd like more information. So with that said, I just invite you to take a moment, look at your notes. Maybe you have a little hexagram of the 6 different domains that you can use to work through your client. Maybe you have a little bit on PARQ, as well as the history of it. So when you go to explain how this works, why this works, you can say, hey, when synapses fire together, they wire together. When we have an association with one heart event, we can overgeneralize it to different events. Can we tease that apart by becoming present with the sensation, by entering different states of consciousness? And by consciousness, remember, it's just the 5 senses to get there. So hopefully you have some really useful notes and tools. There's also handouts. I hope those are also really useful for you. And with that, just take a moment to digest. Maybe you relax your shoulders down, nice and soft. Maybe you swallow. And just noticing the esophagus, noticing the belly, just feeling content with something new you've anchored, just full digestion. With that, we'll take a deep bow to your wisdom, art, just a big bow of gratitude for the work you're doing for yourself and in this world. From my heart to yours, can't wait to see you next week.